This is the abdomen. Which of the following pulse sequences is crucial for characterizing lesions of the adrenal glands? In phase, out of phase, gradient, echo. Amylase, lipase, and peptidase are digestive enzymes secreted by the what? The pancreas. What part of the pancreas lies within the curve of the duodenal sweep? The head. That's also called the romance of the abdomen. The head goes into the curve. Which structure is considered the largest lymph organ in the body? The spleen. What weighting is this image? That is a T2. This is the gallbladder here, and that's filled with fluid, and it is bright. Also, you can see the CSF here is bright as well. What is structure C? That is the left lobe of the liver. For which of the following considerations is contrast indicated when performing MR examination of the abdomen? Differentiation between metastases and hemangioma. Contrast is always good for doing that differentiation. Which of the following muscles forms the anterior abdominal wall? That's the rectus abdominis. That's a giveaway question. The pancreas is an abdominal organ located in the retroperitoneum. You really just have to look and memorize a chart of which ones are retroperitoneal and which ones are peritoneal. Name the structure A. That looks like the pancreas. Oh wait, no. That is the splenic vein. So I think I first guessed that this was like the pancreatic duct, but it is actually the splenic vein here because it looks like the other veins. It's black. Which structure separates the right and left lobes of the liver? The main lobar fissure. This was a trick question because the ligament lies within the main lobar fissure, but for some reason we don't say that a ligament separates the right and left lobes. It's a fissure, which is a dip. It's a negative space. Separates the right and left lobe, and the falciform ligament sets inside of the main lobar fissure. Which of the following spaces is located between the diaphragm and the anterior portion of the liver? That is the subphrenic. The common bile duct is formed by the union of the cystic and common hepatic ducts. It's really good to look at a coronal image of the ducts, or to look at an illustration of the left and right hepatic ducts, common hepatic duct, and the CVD and the cystic duct. And once you visualize it, you just know it by heart. Which of the following arteries is not one of the branches of the celiac axis? The cystic artery. So the celiac axis is the first branch off of the abdominal aorta, and it branches into left gastric, hepatic, and splenic. You can remember celiac axis as the celiac disease, in which people can't have, I think it's certain wheat. I'm not sure exactly, but anyway, so that's related to gastric, it's related to digestion. So this is the gastric artery, hepatic artery, and the splenic artery. Those first superior three organs. And number 15, the structure serves as a protective barrier to help prevent the spread of renal infections. Gerotis fascia. So this is a wrapping. Just think of it as a wrapping. Just like, you know, when you buy candy at the store, it's got a wrapping on it, and that's to prevent germs, okay? And germs cause infections. So if you can remember that the kidneys are covered with Gerotis fascia, then you will know that answer. Which plane best demonstrates the pancreas and abdominal MR imaging? The axial. That's because of the curve, like the way it's curved inside the body, you really have to get a nice axial slice to see the whole thing. Which structure should the horizontal alignment light be positioned when setting up a patient for MRI examination of the liver? 2 inches or 4 fingers above the iliac crest. Okay, sure. What condition may develop in association with obesity, malnutrition, chemotherapy, radiation, hepatitis, and/or alcoholism, resulting in an excessive collection of triglycerides and other fats in the liver? That is fatty infiltration of the liver. All they had to say was alcoholism, collection, fat, liver, and that's how you know fatty infiltration of liver. Which of the following would not be an indication for MRCP exam? Constipation would not. Okay, so all of these other things are related to the gallbladder and the ducts. Okay, so constipation is not related. Name the structure C. Is that the caudate lobe of the liver? That is the caudate lobe of the liver, yes. And I just remember that because on an axial, the caudate is closer to the tail, which is an extension of the spine. Caudad means tail, so caudal, caudate, further towards the tail. Not as in superior, inferior, but as in anterior, posterior. So the quadrate lobe is more anterior and the caudate is more posterior. What medical term is used to describe dilation of biliary ducts? Cholestasis. So I think cholestasis means that nothing's moving. The flow is not moving. Just like homeostasis, when you're in homeostasis, you're in a state of perfect balance. Nothing moves. You're perfectly at peace. So when you have cholestasis, your bile is static. It's just sitting still. And that is not normal because the bile should be flowing constantly. And so if it's just sitting there, it's because it's backed up and it's not allowed to flow freely. And it will cause the biliary ducts to dilate and they build up with that icky bile. This structure supports stability of the liver, that is Glissen's capsule. What is the weighting of this image? That is T2 weighting. How will the affected hepatocytes appear in a patient with hemochromatosis? So I think they have too much iron in their liver and it's going to look hypointense. I don't know that by heart, I just have it memorized. Name the structure B. That is your portal vein. Name the structure in B in this image. Structure B in this image is looks like a muscle. That is the quadratus lumborum muscle. It's going to the side of the vertebrae there. Which of the following is not a part of the portal system? The hepatic vein is not a part of the portal system. You know what is a part of the portal system? Superior mesenteric vein, splenic vein, and the inferior mesenteric vein. Okay? Using this type of pulse sequence with a very long TR and very long TE allows for visualization of fluid contained within the biliary system. Single shot fast spin echo. The SSFSE. I just remember that from doing the MRCP exams. Structure C, that's the psoas muscle. The largest lobe of the liver is the right, that one's easy. Morrison's pouch is in the subhepatic space. A patient presents to the MR department with hypertension. You should do an MRA of the abdomen. Okay? Which structure lines the abdominal cavity wall? Parietal peritoneum. You know it's not the visceral peritoneum because that covers the organs. A is the fundus of the stomach. Look at that. How cute. The stomach is an abdominal organ located in the peritoneum. Which vessel supplies blood to the descending colon? The inferior mesenteric artery. It's not a trick question. The structure identified here is the supracolic and infracolic compartments. Oh, I see. The structure identified in this image divides the abdomen in two, and that's the transverse colon right there, and it divides the abdomen into supracolic and infracolic compartments. An imaginary line between what two landmarks provides the inferior boundary of the abdominal cavity? The sacral promontory and the pubic symphysis. Name the structure A. That is a vessel. That is the common bile duct. Current practice divides the liver into how many segments? 8. And they're kind of confusing if you look at them, to be honest. Which structure joins together to form the renal pelvis? The calyces. The calyces. MRI examinations of the liver are indicated for which of the following abnormal liver function tests? Yeah, so you're going to give a blood test, and if you have abnormal liver function, then you might need an MRI after that. B, that looks like the descending colon, yep. And B here is the linea alba, so that's the white line that divides the rectus abdominis muscles in half. The congenital absence of one kidney is renal agenesis. That was a giveaway question. What medication is administered to minimize peristaltic motion of the bowel during imaging? Glucagon. Structure A is what? What do you call structure A? That is the fissure for ligamentum venosum, which is a pretty cool name. Ligamentum venosum. Sounds like venom. A MRCP exam concentrates on which area of the abdomen? The biliary system. Which of the following pulse sequences is crucial in distinguishing between adrenal adenoma and adrenal hemorrhage? T1 weighted, incoherent, gradient echo, in and out of phase. I don't know how I knew that, but I got it right, so I'm just going to have to memorize that for future. Structure A is the renal artery. And that's everything for the abdomen.